In today's video, we're going to be discussing the ligaments of the knee, and I can already tell you that there are a couple more of them than you realize. You don't have to, but if you want to, this is a 100% free Kenhub article that you can follow along with me because we've put a link in the description below, and that way you could see exactly what I'm talking about, and you could take your own time to investigate it yourself, because this image here is really cool. There's a lot to look at, and honestly though, we're not really focused on 99% of it. Our focus is going to be on this structure right here, which is called the patellar ligament. Now, depending on the text, you may call it the quadriceps tendon, you might call it the patellar tendon. I have always taught it as the patellar ligament, and I think when you see it from this view, that's going to make a lot of sense. But to understand that, we also should probably define what a ligament is, because a ligament is going to be different than a tendon in the sense that a ligament is dense connective tissue that is connecting two bones together. And its purpose is to define the range of motion. Basically, a ligament is put somewhere so that it'll get tight and it will prevent an unwanted movement. That's pretty much the purpose of it. Unless you're the patellar ligament, because the patellar ligament actually works with the patella and then the tendon of the quadriceps group to help move the tibia. Because if you can see this right here, this is the distal portion of the quadriceps where basically all four of them are converging into the patella, and what will happen is they will contract, it'll pull on the patella, which will then move, and obviously that will move the patellar ligament. So yes, a ligament connects bone to bone. Yes, it defines the range of motion, but sometimes it can also work with muscles to produce motion at a joint. But the patellar ligament is a really cool piece of tissue. In fact, this is one option for a ACL repair. If they wanted to, and we're going to be talking about the ACL, they could take a little section of this and implant it in the center of the knee. It's an option. It kind of depends on your orthopedist and what their view is. But this is our first ligament, and this is probably one that you weren't expecting. But there are two more that you're probably not expecting, because whenever I talk about the ligaments of the knee, everyone kind of just quickly talks about the big four, right? The Mount Rushmore of sorts of ligaments. But there are a few more than that. In fact, actually, real quick, I just want to show you this. This is showing you that patellar ligament as it is being stretched. You're seeing this knee is going into the position of knee flexion. And as it does that, this ligament is going to be stretched. And so you can see that that is also going to still have a ligamentous purpose, right? It's going to be there to help kind of limit how much flexion you can do. But at the same time, it's working with that quadriceps tendon to actually produce the motion. So we'll make that get a little smaller. Instead, we're now going to look at the first of the big four. And so this right here is what we would call the fibular collateral ligament, but most people would actually just call it the lateral collateral ligament. This is your LCL. And so the LCL is, get rid of that text real quick. The LCL is this ligament that's going to be on the side of your knee. So if you actually go down and feel your fibula, the head of your fibula, you could feel on the side that there's this band of connective tissue that is going all the way up onto the lateral condyle of that femur. And what this is going to do, actually all of these ligaments, this is what I want you to do, is get into this habit of just going what would have to happen to make that ligament tight? And so what we have here on the LCL is, obviously it's on the lateral side, it's in its name, but when that is going to get taut, that is an action that does not exist at the knee called adduction of the knee. So basically, it's kind of hard to explain, but picture I don't know, I'm trying to think if I could stand up almost to show you this, but it's your knee is basically just a hinge. It has some rotation, it's a small amount, but it's essentially just going to be a hinge. But I want you to imagine, instead of just hinging, what if it could go to the sides? So if it went in towards your midline, we call that adduction. If it went away from your midline, like it's going away, like my arm is going away here, we would call that abduction of the knee. And what's going to happen is the LCL, that fibular collateral ligament, is going to limit the amount of adduction that is possible in the knee. But that's not it, actually. In fact, we're going to see that every single one of these ligaments are also going to limit hyperextension. Hyperextension of the knee is a catastrophic thing. your knee does not want to hyperextend. So hyperextension, so extension is when you're like kicking a ball. So I want you to picture yourself like kicking a ball. That is going to be extension. Hyperextension would be going beyond the normal range of motion. And your knee really does not like doing that. And so what we're going to see is all of these ligaments are going to contribute in some shape, way, or fashion to preventing that action from occurring. And sure enough, the LCL is no different in that. But the LCL has a big brother of sorts, and it's going to be on the opposite side. So if we come over here, you can now see something very similar happening. It's just on the other side, and this is called the tibial collateral ligament, but most people would just call it the medial collateral ligament, or MCL. This is a very commonly injured ligament. I don't know the statistics off the top of my head in terms of how much more likely it is to be injured than an LCL. I just know it is more commonly injured than the LCL. I also, though, know it's not the most commonly injured. That is going to be another ligament that's coming down the pipeline here in just a moment, but this is going to do the exact opposite of the LCL. So if you remember, abduction of the knee, that is an unwanted movement where your knee is like going away from your body to the side. That's what this is going to help prevent. But it's also going to help prevent that hyperextension as well. But what this image isn't really showing all that much, again, that wasn't really the intention of the image, is that there's also a deeper structure inside of here called the medial meniscus. It's a fibrocartilage pad, and that helps kind of like absorb the shock between the femur and the tibia. And what's going to happen is the MCL will blend with it, which means that if the MCL rips, it's possible to tear off a piece of that medial meniscus, and that is unfortunately fairly common. So we have the MCL, and then again going back, we have the LCL. Both of these are the collateral ligaments. You can think collateral, like collateral damage. That's how I do it in my head. Those are just going to be on the sides of the knee. But like I said, these are not the only ones. So what I'm going to do is I'm going to make this smaller, and you can see the rest of the text there discussing it. Now I want to talk about two ligaments that you probably don't know really exist. The first is what's called the oblique popliteal. So the oblique popliteal is this, basically it's an extension of a muscle in the hamstrings called the semimembranosus. So semimembranosus is going to come down and it's going to insert on that posterior aspect of the medial condyle of the tibia. And what's going to happen is this extension is going to then grow outwardly and cross from the medial to the lateral side. So the medial side of the tibia to the lateral side of the femur, right here on this condyle. And it's not a really strong ligament. It's kind of like blending with like all of the other connective tissue in this area. I mean, you can even see popliteus muscle right here is just going to be deep to it. But this is going to help limit hyperextension of the knee. It's also going to help limit some rotation as well, but it's really going to be there to help limit hyperextension. This is just a ligament that whenever I ask people, like, how many ligaments are in the knee? They're like, four. And I'm like, well, no, there's actually more than that. Like if we count them all up, there's pretty much 7 large ligaments that everyone would agree on. And the other one is this one here called the arcuate. So the arcuate popliteal. And so the arcuate popliteal, again, popliteal just means that space in the back of the knee. And so when we saw the oblique popliteal, the arcuate popliteal, but this is going to be on the opposite side, and it's doing something very similar. It's going to help reduce some of the rotation that's possible in the knee. But it's mainly going to be there to help limit hyperextension. So you can see it attaching here on the head of the fibula, coming over, and attaching to that lateral condyle. This thing is basically there to just kind of help further anchor this whole system down. But once again, hyperextension is the name of the game. Okay, so now let's talk about probably what I would argue is the most famous ligaments in the knee, and that is going to be the cruciate ligaments. And so just to make sure we're all on the same page, this is an anterior view of the knee, but what's happened is the patella, or the kneecap, has been removed. And that had to happen in order for us to see inside, because the cruciate ligaments, cruciate means cross, are going to be crisscrossing inside of the knee. And they do that in order to prevent the tibia from basically sliding in front of or posterior to the femur. And the first one we see is the anterior cruciate ligament, or the ACL. This is the most commonly injured ligament in the knee, if I'm remembering my statistics correctly. Don't quote me on that, quote me on the anatomy. But this is, even if it's not the most, this thing is very commonly injured. And what it's going to do is it's going to prevent the tibia from sliding anteriorly to the femur. So we'd call that a forward translation. And so it would get taut and just prevent it from going. In fact, if you ever, if you're in, some clinical anatomy, or you're maybe doing some like rehabilitative courses, you may have heard of like the anterior drawer test, where you will grab the back of the calf and you will yank it forward. And by doing that, what you're doing is you're testing to see the strength of that ACL, because it would prevent the tibia from coming forward. But then if I go to this other view here, you can see the ACL from a posterior view. So what's happening is you can't really see the PCL from this view, but we will see that in a second. But this is also going to show that it's basically crisscrossing with the PCL, but it's going from anterior to posterior. And again, that's going to be essential in order to prevent any kind of forward slippage. So then what we could do is see this view of the PCL. So I'm going to actually go back and show you the difference here. ACL is going this way, but you can see the PCL behind it. So then if I come over, you can then see, okay, here's the PCL, but we've removed that ACL so you can better see the PCL. And then we can also see it from this view, but now we can also see that ACL as well. And the PCL is going to prevent the exact opposite. It's going to prevent a posterior translation of the tibia in relation to the femur. So basically it's going to prevent your tibia from sliding backwards, because that's just not a good day. No matter how you count that up, that's just definitely not a good day. But these again are the cruciates. And so in fact, I would say like one of the nastiest injuries that is possible is what is called like the terrible triad, which is where someone will get hit on the outside of their knee, on the lateral side of their knee, but that will basically force the knee into abduction, which will cause the MCL to rip, which will rip out. And here you can see that MCL blending with that medial meniscus, where we couldn't see that before. And if you look over here, the LCL has this gap, so it's not blending with that lateral meniscus. So let's say you're playing soccer or football and someone lands on the lateral side of your knee, forcing it into abduction. Well, the MCL's job is to prevent that from occurring. So what'll happen is it's going to get ripped. But it's also possible, again, like I mentioned earlier, to bring the medial meniscus with it, because you can see the fibers blending with each other. But this typically doesn't happen in just a purely side-to-side motion. Instead, what can happen is it's coming from the front of the body, which would also force the tibia in front of the femur, and you would rip the ACL. The terrible triad is ripping the ACL, the MCL, and part of the medial meniscus with it. None of those are wonderful things, to say the least. But so these are all of the major ligaments. Now you can see there are accessory ligaments. Like if I go back here, you can see some other, ligaments associated with the menisci. But I mean, in terms of the major ligaments, these are the ones that we're really going to be focusing on. So what I want to do now is I want to take a quick quiz to see how well we're doing with retaining this information and whether or not you can identify each of these ligaments. Okay, so I've started a custom quiz here, and what's nice about the custom quizzes is that you can decide what you want to be tested on. That way, if there's certain things you're like, I just need work on that thing, you can focus on that. But we also have the option for other quizzes, in case you're curious, where you can also teach yourself new things, where you don't even have to read anything. You can actually just kind of like take the quiz, and it will teach you as you go. They're really, really cool, and I can kind of show you how that's going to work. But we are going to take a quiz with just 11 unique structures. So this is going to be pretty cool, but you might be like, why? Just 11? We're going to go through that so fast. No, not at all. Watch this, because when I hit start quiz, what you're going to see here is we have two different options, right? You can take a study quiz, you can take an exam quiz. A study session comes with spaced repetition, and this is something we are just super passionate about here at Kenhub. And what spaced repetition does is it exposes you to the same questions multiple times in different ways. that way, you know, you just kind of like you become more familiar with it and it becomes easier to learn and understand it. Whereas an exam quiz is exactly what you'd expect, right? It's there to test you. So I want to do this study session because I'm such a big fan of spaced repetition. I'm going to lower it to 5 questions. I'm going to hit start. I'm just kind of warming up. You know, I feel like I gotta do stuff. All right, so here we go. It's asking for the arcuate popliteal ligament. By the way, if you need to pause this at any time, especially as these pictures get smaller, I totally get it. However, whenever I can, I will hit this little eye icon because watch this, it gets bigger. And look, if you're not like me, you're probably watching this on your phone. And so last thing you need is like this tiny little thing. So again, don't be afraid to pause the video if you want to take your time. But it's asking for the arcuate popliteal ligament. So as we're looking through this, the answer, it's going to be this one down here. So let's actually, before I click it, we can hit the eye and you can see the arcuate popliteal coming off the head of the fibula, coming over to that lateral condyle of the femur. But let's go ahead and click it and boom, and was not expecting this. I'm actually super excited. Okay, look, I'm not a radiologist and I don't pretend to be one on the internet. I am super excited about this. You get to see this in action, everybody. I was not expecting this. So it is asking for the LCL. All right, so here's how we do this. This is how I do it. Is first you got to orient yourself. What are you even looking at? And what the cool thing about our images here at Kenhub is if you look really closely, look, I'm actually going to go like this. And I'm going to show it to you, like blown up portion of this zoomed in. You can see we're showing the view you're looking at to an extent. Right, you can see this blue line here showing that we have a cross section in that transverse or horizontal plane. And if you looked closely, it's the same thing for all of them. So just kind of orienting you. So we know this is obviously going to be in the knee. The question then becomes, and this is something I recommend every single one of you do if you are, you know, encountering an image that you're not 100% sure on what's going on or what you're even looking at, is to orient yourself as much as possible. I want to discover where anterior, where posterior, lateral, and medial is, because the fibular collateral ligament is the LCL. That's the lateral collateral ligament. So if I can figure out what's the lateral side, that's going to be super helpful. So the thing that my eyes are immediately drawn to is going to be this right here. These are the condyles of the femur, which tells me, all right, you know, obviously we have part of the femur that in view here. And so then you got to figure out, okay, well, which portion is the posterior side and which portion is the anterior side? Because the condyles means knuckle. And the rounded portion that really looks, I was about to say knuckler. I don't think that's a word. Knuckler is going to be facing posteriorly. In fact, so that's what this is going to be. This is going to be the posterior side. And so as I'm looking at this, I would say like, okay, well, it's definitely not going to be that, because that would be anterior if this is the posterior side. This is one of the condyles. So then the question is it this one or this one? And if you look closely, in fact, I can make it so we can actually see this. Let's see if we can get this first image. That wasn't the image I was looking at. Where'd you go? That's what's cool, is we have so many images that are all super helpful, but I don't think it's the exact one I was looking for, but it doesn't really matter. But this is bigger than this one. And so that is meaning, or that means this is going to be the MCL. The MCL, or the tibial collateral ligament, is larger than the fibular collateral ligament. I realize I'm taking way too long. Anyways, it's going to be this. I'm excited. You probably don't care all too much, but I am pumped right now, actually, about that. All right, so let's do this. We're going to go lightning fast because I got like a minute and a half. Which image shows the anterior cruciate ligament? I don't know why I did that. I'm going to go with this one. So that's because this, actually, I'm not going to tell you who that is because it might ask you what's next. Boom. Ooh, it didn't. But what is that? Because we've already revisited this. What's cool is, see, again, you can see this spaced repetition in action because it is showing you the same thing. It's just showing you in a slightly different way. This is the arcuate popliteal, correct. I knew you got it right. See, you're smart. Ooh, I love it. They're showing a view that we've never even seen. We saw it, but we didn't really focus on it. It's asking which image shows the medial meniscus. Fascinating. So what it's showing here is it's highlighting this thing in green. And then here it's highlighting this in green, and it's showing it much larger. Which of those is going to be the medial meniscus? That is going to be this one right here. Now, the thing I also want to show is you can actually go backwards in case you want to be like, what? What was that? But remember, the medial meniscus, this is a fibrocartilage shock absorbent pad that is going to be between the femur and the tibia. All right. Got only like 2 more questions. Which image shows the patellar ligament? Patellar ligament. Aha, it shows that one. Boom, it's going to be this one. And here's our last question, because I took way too long talking, getting excited about the MRI view. Anterior cruciate ligament. So we're looking at the ACL again. Now, we've been asked about the ACL, but now we're seeing, last time we saw 2 images, now we see 4. Again, this is just showing that spaced repetition in action. And so, which of these is it going to be? Why not? We have the time. Here, watch what I'll do. I'm going to show you each of these. We're going to make them larger. That way you can see it. So you can see this one. You can see this one. Ooh, they're even adding more. I like it. I like it. This one. Showing a different view than what you see here, but I like it. Or this one. We didn't even talk about this. Well, I think I did. I kind of mentioned it. I almost said what it was. I really got to stop that. I have a bad habit of ruining these as we go along. The answer is going to be this one, anterior cruciate ligament. All right, we did really good. I think we got 100%. Granted, we didn't answer that many questions. I'm not pointing any fingers. I'm not saying anyone's to blame. What's cool is you can save the copy of the quiz. I don't really want to save it, but you can then also see, I love this part. You can see just your progression through the quizzes, because you can take this again. I mean, like, again, you can save it. You could retake it immediately. You could start seeing just how you're improving. There's a lot of really cool metrics that we're working on to just improve your overall experience. So again, you can really start to understand this. But my hope is that you have a solid understanding of the ligaments of the knee now. The knee is such a fantastic, it's something that's really cool to teach about, because I think it's really cool to look at. I think people just have this really strong intuitive sense about how solid the joint is, meaning that if it starts to get hurt, how bad that is. Whenever I'm teaching about the ligaments of the knee or just knee anatomy in general, people get pretty excited. So my hope is that, some of that came across in today's video. My hope is that you will also tell us what else to discuss. Go to the comment section right now. Get down there, tell us, hey, I want to talk about this structure or this region or this process. Like, we are always looking to make videos that you want to see. Right now, it's like sometimes you just have to play this guessing game. You're like, I hope they want to see this. And I do hope you wanted to see this, but I would much prefer you tell me what you want to see, and then, we can make that in future videos. But while you're down there, be sure to like this video, subscribe if you haven't already, and I will see you in the next one.